Upon my doctor's recommendation, I will remain in self-isolation for 14 days. I want to be clear, I have no symptoms, and I'm feeling good. And technology allows me to work from home. Of course, it's an inconvenience and somewhat frustrating. We are all social beings, after all. But we have to do this, because we have to protect our neighbours and our friends, especially our more vulnerable seniors and people with pre-existing conditions.
That is Canada's Prime Minister, confined to his own home by the coronavirus. These are extraordinary times. Good evening and thanks for joining us. The Prime Minister is not sick, does not have COVID-19, but his wife Sophie Gregoire Trudo does, and so he's working from home. This pandemic is having a profound impact on all of us, and events are moving fast. Here's where we're at right now. Canadians are advised to avoid all non-essential travel outside the country. Parliament has suspended sitting for at least 5 weeks. The Bank of Canada cut interest rates today to 0.75%. National museums across the country are closing. Europe has been declared the epicenter of the pandemic. And the American president has declared a national emergency. The number of cases in Canada keeps rising. There are now almost 200 confirmed cases of COVID-19. 7 provinces now have cases. Ontario is reporting the biggest jump in new cases, 19 in the past 24 hours. We have lots of ground to cover tonight. Let's start with David Akin in Ottawa and the message from the Prime Minister. David.
That's right, Donna. It was almost as if to underline the fact that being at home in self-isolation does not mean being inactive. Justin Trudeau, his cabinet, the Bank of Canada, made a blizzard of announcements Friday.
I know that you're worried. You're worried about your health.